curious about this song. So can you hear me okay with the mic? All right, I'm still old-fashioned enough to need a bit of paper. So my goal today will be, it's the end of a long day, to hopefully not put you to sleep. So I'll try not to do that. But Julie, I'm so happy to be here, and I want to thank you and the organizers of this first-of-its-kind conference for inviting me. And as you may know, as Julia said, I was the chief medical officer at GSK until about 6 weeks ago, transitioning to this new role, where over the last 3.5 years, I've had to defend the company and its products many times for things that, quite honestly, the industry has a lot to answer for. So I can't tell you what a pleasure it is today for me to talk to you about many of the good things that the pharmaceutical industry does and contributes to global health, and why we believe at GSK, and actually many colleagues in many companies understand, that contributing to global health is also very good for business and society benefits. And I'll try to demonstrate some of that today and some of the things that I'll talk to you about. All right, so doing well by doing good. I think that Julia mentioned in her introductory remarks about innovation. Innovation hasn't always been associated with access. To me, that's absolutely essential that they go together, because if the world can't benefit, particularly from health innovations, we would actually have quite a lot to lose. As you heard from my introduction, I'm actually an ophthalmologist with training in public health, and early in my career, I worked with colleagues all over the world to eliminate blinding eye disease and also HIV. What you may not know is that Merck was the first company to actually donate drugs on a large scale for neglected disease. Ivermectin for onchocerciasis. You might be interested to know that that program is going to celebrate its 25th anniversary this year. And that, yes, I won't tell you how old I am, but you can guess I was there at the beginning. But it's just amazing to think that for 25 years, Merck has donated this medicine. So when I joined Merck in 1991 to participate in developing medicines for HIV and blinding eye disease, and got to be part of a drug donation program, it seemed like a dream come true. And it's always been essential for me to work in a place that actively and relentlessly contributes to public health. Merck was such a place then. It's still a company very strongly committed in that area. And in every job I've had in industry in the last 21 years, I've had the chance to contribute to global health in those roles, and especially my work at GSK. And you can see from this quote, when Merck founded the company, about 50 or 60 years ago, he knew even then that a medicine that would be important to society would be important to business. And that's the theme of my talk today. So I do have a fair amount of content to share with you today, and I know it's the end of the day, and I once got some advice very early in my career that even if you have a lot to say, your audience is probably going to only remember 3 things. So I'll try to capture the essence of this in 3 ideas now, and try to explain them as we go forward. So I do think, and it's very, very simple way to look at it, business benefits from a healthy society, and society does benefit from a healthy business. And if not now, when? I firmly believe that it's impossible to separate business interests from society. The well-being of a community, a country, a region, our world, is driven by the ability to stimulate private sector growth. The healthier a population, the greater its potential to create a prosperous environment for itself and contribute to the world community. Companies can deliver good value to their shareholders and make a meaningful contribution in all the societies they operate in, and this does not need to come at the expense of profits. And why should this be so? Frankly, because there's a powerful convergence of interests for the well-being of society and business. And I had a chance to spend about an hour and a half with the group in the conference right before I came here. That's the premise when you were working up your case studies that you're all working on today. And I have some more ideas about this. I think, Julia, you mentioned the Millennium Development Goals. So let's take a look at this from the perspective of 2 organizations that might have very different views, as you might imagine. The World Health Organization and the World Economic Forum. So here are the Millennium Development Goals. 8 goals endorsed by all 193 United Nations member states, and I think 23 or so international organizations, committed to in the year 2000 to be achieved by the year 2015. The theme of these goals is to raise the standard of health and well-being for everyone in every society, and particularly women and children. And in June of 2005, to accelerate progress, the G8 finance ministers agreed to provide enough funds to cancel about $55 billion of US debt so that a number of poor countries could rechannel these resources to social programs, programs designed to improve health, to improve access to education, and to alleviate poverty. Now, why would they do that? Well, because the G8 finance ministers know firsthand what the negative impact to society might be if these goals were not achieved. And they know, because they meet in Davos every year, the same people at the World Economic Forum, to look at the global state of the world economy and its health. And a hot topic over the last couple of years have been the risks to society. There are many risks here. The ones with the greatest impact are economic disparity and governance failures. And I want to talk a little bit about these, because why they may occur and why the solutions to these have a great convergence with the contribution to world health. So the great paradox of our century, if you like, is that as the world grows together, it also grows apart. Globalization has generated sustained economic growth, but its benefits are very unevenly spread, and the evidence that economic disparity is growing. To meet these challenges, global governance is essential, and the conditions that make it so important, the divergence of interest, differing values, norms, standards, also make it very complicated and very messy to do. Common to both the MDGs and the World Economic Forum risks is the impact of illness on populations in the developing world. This was evident in the MDG goals you just saw, and you can see them here on the risk slide. You see chronic diseases and infectious diseases really along the major axis of risk. Broadly, the solutions will require the alignments of interest both in the public and private sectors, because quite frankly, the resources of both will be needed. Now, this next slide demonstrates a fascinating shift in the burden of illness facing the world population. But the likelihood of death from chronic illness will surpass, at least in terms of numbers, the death from communicable diseases. And this is something that has changed in the last 10 years and will accelerate even further in the next 10 years. It's a very interesting condition of the world that there are more people who are overweight, about 1.2 billion, than there are who are undernourished, about 900 million. It's the first time in human history this is so. Now, this shift doesn't mean we take our attention off of communicable diseases, and the distribution of these diseases is very different, and I'll come back to that later. But it does point out the convergence of interests for both sets of diseases, chronic and communicable. So the solutions, and the societal solutions and the business solutions, will need to address both. India, China, Southeast Asia, Sub-Saharan Africa need treatments for diabetes and cancer, as well as vaccines and medicines for endemic tropical diseases. And countries in the developed world still need vaccines. They need pandemic flu, treatments for cholera that may be required, especially from some of the natural disasters we've seen most recently in the few years, tsunamis and earthquakes. Pharmaceutical companies actually have the products, the knowledge, and the resources to address many of these illnesses, and their concurrence in many of emerging markets necessitate the need for business solutions that also address society's needs. So I'm going to spend a little time now on talking about how GSK contributes to global health. Now, I will admit to being somewhat competitive about this, so you'll hear mostly about what GSK does. But you'll also see, as I describe some of these activities, that many companies participate, and without the participation of many, these goals couldn't achieve. And quite frankly, in business, we do want to achieve. We like to be first. We like to be best. I can't think of a more worthy thing to do than try to lead in the area of global health. And it does make me very proud to work at GSK. So let me talk about 3 areas: business practices, R&D, and humanitarian programs. I'll go through some of these and before we close at the end. So perhaps something very close to my heart is the ViiV healthcare business. In 2009, GSK and Pfizer jointly created ViiV Healthcare, which is now a standalone business dedicated to providing medicines, research, and advocacy support for people suffering with HIV/AIDS everywhere in the world. And I've been on the board of directors of ViiV since the company was started, very pleased with the progress. And just as a sort of a personal story, I was at Pfizer before I joined GSK in 2008. The idea for a dedicated HIV company started when I was there in business development. And it was very rewarding for me to actually go to GSK and see this proposition come to fruition. At ViiV, we do well by doing good, by generating important revenues for both parent companies, and you see that here. And we've also impacted the lives of millions of patients with our medicines, more so than either company ever did alone. And we're very attentive to contributing to programs that assure access, and I think our most salient contribution here has been the positive action for children with HIV, and we contribute to that fund. So this is a novel joint venture. It's a model I hope that I see other pharmaceutical companies collaborate on for areas of unmet medical need, and it's been tremendously successful so far, year 3, for HIV. So I've talked to you about a business model based on a disease area. Now I want to talk to you about a business innovation based on geography. In 2010, GSK created the Developing Countries Operating Unit to expand access to GSK medicines. And you can see part of the reason why we did this. If you look at this chart here, some of the least developed countries today have some of the fastest growing economies, and this is going to accelerate in the next 10 years. So this unit, which encompasses about 50 countries, reaches nearly 800 million people living in them, and more than half of those people live on less than $1 US a day. In these countries, GSK caps the prices of our patented medicines and vaccines to no more than 25% of the developed world price, with a goal of increasing this volume 5-fold over the next 5 years. So as a business proposition, the volume will have to follow if we're able to do this. But by creating a lower price point, we also expand access. And as we were talking about in the taxi on the way over here, it's really not sufficient to just do a business, especially in sub-Saharan Africa. This is a capacity challenge. When I actually realized what the numbers here, it was staggering. 24% of the world's health burden, 3% of the world's healthcare workforce, and only 1% of its budget in these countries. So GSK invests 20% of the profits generated in this area of the world into healthcare infrastructure. We administer this through other partners, so we don't do it ourselves, and to train healthcare workers. But we believe it's an important message to send if you're going to operate in countries like this, to be able to provide for the infrastructure as well. Now, for all these lofty ideas, there are some things that we can't control. So this is, again, some of the challenges of working in the developing world. So we cap our own prices, but at the pharmacy level, there may be a markup to the end user. So in the UK, if you actually buy a Ventolin inhaler, you'd pay in US dollars $2.50. And in some parts of Zimbabwe, you may pay $10. So in addition to reinvesting profits, to making sure we have an appropriate price point, we do have to look for even further solutions and work with governments and the society so that in the end, a patient can still get the medicine. And we don't have all the answers to that, but there are things that we're working on. And finally, from the business model perspective, now as a public health physician, something very close to my heart, vaccines. For vaccines, GSK has a long-standing tiered pricing policy that allows poorer countries to pay significantly less than richer ones for the same vaccine. And GSK's vaccines are provided to 182 countries in the world. We shipped last year more than 1.4 billion doses, and 1 billion of those went to developing countries. And you can see here, we do have the largest global business for vaccines, but many companies participate, and the tiered pricing construct that Gavi and UNICEF have promulgated throughout the world is adhered to by all of these companies. You can see here that 50% of the volume from many of our vaccines go to these markets, and they only generate 3% of the total sales revenues. This would not be a sustainable business model if there wasn't a societal endorsement of it. So the Gavi Alliance has been critical as a coordinating body in demonstrating to the world that the provision of vaccines is a good thing, that all countries in the world should have access to it, and that tiered pricing is a viable way to make something as expensive as a vaccine available. And I think it's a model that we could apply to other areas of healthcare innovation. So I've focused mostly on business models. I do want to say a few words about R&D, having had an extensive background in R&D in my career. In R&D, we actually have an open innovation capability, and every business unit in our company has an R&D unit dedicated to the needs of global health. So in our vaccines division, we're working on vaccines for malaria, pandemic flu, and dengue fever. In our pharma side, we actually have an infectious diseases dedicated unit that's working on new treatments for bacterial meningitis, chlamydia, pneumococcal disease, and of course, HIV/AIDS. And in Tres Cantos, Spain, we have a dedicated R&D unit, which we've had now for some years, specifically for diseases of the developing world. And the focus there is on TB, malaria, and kinetoplastic diseases. Also in Tres Cantos, we have the Open Innovation Laboratory where physicians and researchers can come from all over the world to work on projects. And we also participate in the World Intellectual Property Association, or WIPO. And WIPO has a searchable database. We've put hundreds of patents in there that are available for anyone who wants to work on for these diseases. And finally, in our consumer health division, and again, thinking about what we talked about in the conference before I got here, we actually have a new R&D capability dedicated to nutrition. So for that team, if you want to set up your coordinating body, you have to come and talk to me about that. I will say also, as a result of these activities and many others, GSK was first on the Access to Medicines Index published in 2010. I think the Access to Medicine Index has only been published twice. We were first the last time as well, but Merck and the other companies that you see here are quite close. 5 years ago, we're much further away. So actually creating a paradigm where other companies will follow is a great win for society, and of course a great win for our patients. So finally, let me say a few words about our humanitarian programs, and these will be the bulk of my responsibilities going forward at GSK. We do have 2 large mass drug administration donation programs. We donate albendazole for lymphatic filariasis. We've done this for 10 years, and I think we've donated more than 2 billion doses over this time. And last year, we committed to donating albendazole another 400 million doses for the STD diseases in children. I just want to take a digression here and mention that for some of you who have been here in London, you may remember at the end of January, there was the London Declaration. When Andrew and the board agreed that we would actually add the 400 million for STH diseases, other companies were actually very keen to participate. And Andrew and Bill Gates chair a roundtable of companies that are, to facilitate the donation for neglected tropical diseases. When I started at Merck, Merck was the only company that donated medicines on a large scale for neglected disease. And on January 30th of this year, 13 companies pledged to donate all the medicines that would be needed to treat 10 diseases until the job was done. And it's just a tremendous achievement socially and from a business perspective to see that happen in 20 years. And something, quite frankly, I'm very happy I've lived to see and very proud of. We also have more than 36 community partnerships all over the world that focus on teaching and contributing to the community. And then, it's one thing for the business to do work. The people who come to work in the pharmaceutical industry are often very passionate and very dedicated and interested in improving world health. And we offer them a program called the Pulse program. And I just want to say a few words about that. So people come to work and they do that to make their living, but they also would like to have an outlet for their passion to contributing to global health. In the past 3.5 years, we've deployed more than 300 volunteers with 70 partners in 49 countries. And these folk go out on their full salaries for 3 months, 6 months, and sometimes a year to work either at NGOs or in countries on particular projects with the idea that they come back, bring those learnings into the company, and help us develop new programs. And again, part of my work in the coming year will be to take our returning Pulse volunteers and make sure that they're continuing to contribute to the programs we already have in global health. So even as I've described to you the considerable array of activities that GSK undertakes as we contribute to global health, as you can see from this slide, there are still many challenges in front of us. And in the developing world, we continue to have a disproportionate risk of morbidity and mortality from communicable diseases. And I want to say a few words about that. We know from studying the history of communicable diseases that improving the conditions and treatments in these societies leads to greater health, well-being, productivity, and affluence. And for many of these conditions nowadays, we have treatments and cures. And the neglected tropical diseases, the WHO published a report in 2010 that really described the conditions and what society could do about that. And I would just like to read, if I may, some words from Margaret Chan in her opening, the Director General of the WHO, in her opening statement about this NTD report. So please bear with me. Though medically diverse, the neglected tropical diseases form a group because they are all strongly associated with poverty, all flourish in an impoverished environment, and all thrive best in tropical areas where they tend to coexist. Many are ancient diseases that have plagued humanity for centuries. Although they were once widely prevalent, many of these diseases gradually disappeared from large parts of the world as societies developed and living conditions and hygiene improved. So today, though neglected tropical diseases impair the lives of almost 1 billion people, they are largely hidden, concentrated in remote rural areas or urban slums or shantytowns. And they are also largely silent, as the people affected at risk have very little political voice. Now I'm going to read to you another passage from a book from someone in this audience, Mary Dobson, about the contours of disease. And I just would like to share this with you, if I may, because it affected me pretty profoundly when I read it. Page after page of the many diaries, letters, and other medical and personal documents which were explored for the regional study that's described in the book depict the anguish, the grief, the concern, the bewilderment of the daily toll of myriad infections, the dread of infection and epidemic disease, and the relief of healthy times. Every person in this era was vulnerable to and beset by a host of maladies that were ever present, ever irritating, sapping the energy of individuals and taking the toll of others. So this was written for conditions that existed, centuries ago. What Margaret Chan describes in her report in the WHO are the condition of almost 1 billion people in developing countries in the world today. And it's actually possible now with the treatments we have to control or eliminate many of these diseases. What's interesting, and I guess, so Mary, I'm giving you a commercial for your book here, but some of what she's describing actually existed in the UK in the 1920s and 30s in the marshes. Malaria was a big problem here in England. For many of us that we can remember in our lifetime or know people who did. And these passages are almost hauntingly familiar because they describe the suffering of people afflicted by these conditions. But there's an optimistic lesson here. Eliminating these conditions or working to control them allowed the UK to enjoy the prosperity it's had over the last 100 years. So it absolutely follows, if we can do that in the developing countries and the emerging markets of the world, that prosperous conditions will follow. So in doing well by doing good, we see the mutual benefits for business and society, because in these countries, our work, especially in pharmaceutical industries, is both in chronic and in communicable diseases. So let me go back to where I started. And I can say, really, in my view, there's never been a better time than the time we live in now to take advantage of the advancement of science for new treatments and innovation in healthcare. And there's never been a better time to take advantage of technology to facilitate and drive healthcare products and services. And quite frankly, there's never been a better time to take advantage of our mutually dependent interest to find partnerships and opportunities to include the whole world in our work. So I say to all of you and to the challenge of the people around your table today, if not now, when? We can inspire a generation so that 10 years from now, when I get to give this talk again, I can even talk more about the contribution of business to society and to public health. Thank you.